Headaches are a real challenge in all of medicine, and certainly post-traumatic headaches are usually treated, medically. But in this new innovative study in the Journal of Plastic and Reconstructive Surgery, these innovative surgeons from the Mass General Hospital actually have developed a new method of treating these post-traumatic headaches. It's a real pleasure to have with us the author of this incredible study. Dr. J. Austen is the Chief of Plastic Surgery at the Mass General Hospital at Harvard Medical Center. So, Jay, welcome.
Thank you for having me. It's a real honor to talk about our work today.
I just wanted to get your thoughts on how did you come up with the management of these post-traumatic headaches with the techniques that you're doing, and tell us about your study.
As you know, we've been treating patients with chronic headaches and migraines for over 10 years now, with techniques developed by Dr. Gferer and others. And these have been the most challenging and most rewarding patients that I have the pleasure of taking care of. One of the things that we noted was that we were seeing a tremendous amount of patients with a history of trauma. And it's well known that patients with chronic headaches often have a history of trauma. But what's also been generally accepted is that those patients are particularly refractory to conventional therapy. So we were surprised as we went along to note anecdotally that our trauma patients seem to do at least as well as others.
Right, and as good, because originally, as you described, it was discovered for migraine headaches by Dr. Gferer, but you've used it for post-trauma, and you found similar to excellent results, right?
Yes, I mean, as I said, other studies have shown that conventional therapies may work only 35% of the time, which is fairly abysmal for these quite debilitated patients. We were able to compare our patients with a history of trauma, many of whom their headaches developed almost immediately after the traumatic event, and found that they were equally well treated with these decompression surgery techniques.
So what is the take-home message for patients that have post-traumatic headaches, and when should they seek an expert like you, Dr. Austen at the Mass General, or people that you've trained to get this type of treatment? What is it? Should they come to seek you directly, or should they try the medical therapy initially?
Well, my message is first, don't lose hope. These patients, which we see, have chronic pain and are quite disabled and depressed, as we've seen in our various studies of these patients. What I would say is they should always start with conventional therapy. They should see migraine specialists, neurologists, but if those therapies don't work for them, don't give up hope. There may be a surgical solution for them.
Yeah. So it's indeed a pleasure, and congratulations on your work, and we look forward to future and innovative research from you.
Thank you very much. A real pleasure to talk to you today, Dr. Rohrich.